Well, women who fear their biological clocks may run out before they can conceive now have another option.
A new surgical procedure can be the answer for women who aren't ready to be mothers or who must put off motherhood for health reasons. In tonight's cover story, News Channel 5's Linton Johnson brings us the story of one woman who feared cancer would steal her chance to have a baby. But first, a warning: the following report contains actual scenes from surgery.
All her life, 24-year-old Jennifer O'Brien has wanted children, biological children.
There's just something about having your own child, I think, you know, just to look and say, gosh, she has my eyes, or just little things like that.
But in December of 1996, her dreams were dashed. She was diagnosed with leukemia, a potentially deadly cancer. Doctors told her she could be cured with a total body radiation treatment and a bone marrow transplant. But there was a sacrifice. The radiation would almost certainly destroy both her ovaries. She also learned the only way to have biological children was to freeze her eggs now, so later doctors could thaw them and insert a sperm in them through in vitro fertilization. But that had a 1% success rate. So at the time, it appeared there would be no biological kids in O'Brien's future.
I was really devastated when I didn't think I would be able to have children. I mean, I was just heartbroken.
Okay, so let's look at Jennifer's chart here.
But then last year, this man entered O'Brien's life.
As I look at the x-rays, I can see that all the follicles...
Dr. Sherman Silber, director of the Infertility Center of St. Louis.
It's really thrilling. It's exciting.
Dr. Silber was about to become one of the first American doctors to use a new Scottish medical procedure which takes a woman's entire ovary, not just the eggs, and freezes it for later use. And on July 17, 1997, O'Brien was about to become Silber's first patient.
We're about to do the first case in the St. Louis area of ovarian tissue freezing.
This is Dr. Silber's video of O'Brien's actual operation through a special camera. The white object being removed is O'Brien's right ovary. Dr. Silber says egg freezing has a low success rate because doctors can only remove a few mature eggs, and then the freeze-thaw process kills nearly all of them because they're so delicate. But an entire ovary holds 175,000 immature but tough eggs. This process, Silber says, dramatically increases an egg's chance of surviving the freeze-thaw process.
We can thaw that entire ovary back out, transplant it back to the woman 1 year, 5 years, 10 years, 20 years later, and it's still a young woman's ovary.
These containers are called Dewar tanks. They can keep an ovary frozen for, as the doctor said, 20 years or longer. Which raises another question. Could a woman become pregnant with her own eggs at age 70?
No problem. Very easily, no problem.
The reason the ovary's frozen in time.
She could have a baby at any age. The only thing that influences her ability to have a baby is the aging of her ovary. And by freezing the ovary, it's not aging.
As for O'Brien, she has had her bone marrow transplant and radiation treatment last September. And if she's cured of leukemia, she could have biological children in 5 years.
I just thought it was a miracle.
Linton Johnson, News Channel 5, cover story.